She's 125 pounds, 5'7". Hey, Doc, I write from Italy. I love your work, and I want to thank you for everything you do to spread the truth. Well, honey, come with me and spread it with me. Let's all spread the truth, because lies just ain't no way to go. I mean, you can't ever come back from that, It's like you have to tell another one and another one and another one. I've been vegan for 8 years now, trying gradually to become raw vegan fruitarian. Well, if you're going to be vegans, try to make it, I'd say at least 60 to 70% fruit and the rest vegetables. Don't go totally into the vegetables. You're a Homo sapiens. You require fructose. So you really want to have a lot of fruit in your diet. Like I said, breakfast fruit, night fruit, lunch, do your thing. Have a big old salad, baked potato, whatever you want. But if you're going to do dead animals, like I said, put a little piece of chicken or fish on top of salad. I never liked fish. They stink. They putrefact so fast. My grandfather loved to take my grandfather, same guy, built a house on the island out here in 1950. Well, I was born in 1950. So we started coming down summer and winter, and then when I went to school, I went 1 year to elementary school down here. And, God, this was so much nicer than farmland. Having the beach and everything, oh my God. Yeah, as soon as I could get down here in Florida, I did. So I was diagnosed 3 years ago after a sprain with bone edema in my big toe. Ooh, I don't know if I like that. Oh, swelling of the bone marrow. Oh, man. No, that don't sound good. That does not sound good. Well, that's how you lose your platelets and your white blood cells and stuff like that. Now it's very few liquid left in it. I can walk much better than 3 years ago, and it's improving. Okay. 8 years ago, also was diagnosed with genetic connective tissue disorder. Now we're getting somewhere, aren't we? Mm-hmm. Mm-hmm. So with that kind of diagnosis, what do they call it? Ehlers-Danlos syndrome, hypermobile type. Okay. I've heard of connective tissue disorder, but I don't believe this diagnosis because I don't fit all the criteria. Yeah, that was kind of a diagnosis that just didn't fit me either. But the fact that you could have connective tissue issues is very important. So what would you think there? Parathyroid glands? Absolutely. You're 5'7", so I would be kind of peeking up at what? Your pituitary gland, honey, because how old are you? You're 30. Oh, you're 32. So you probably already had your kids. Could you conceive? Could you carry? Things like this is important for females because, I mean, they're the ones, right? So their health is vital. And especially with these kids and having kids and raising your kids. I mean, who wants to have genetically weak kids and have to go to the medical all the time and put up with their crap? They don't have a clue how to regenerate tissue, of course, because they don't have a clue what causes these things. If you don't have a clue to what causes man's problems, even genetics, you're not going to have a clue how to fix it, right? Right. So I'm going to say, look at your parent. Wait a minute. We have eyes on this young lady. We have eyes. Okay. But I do have severe pain, inflammation in all my joints. Okay. So you're too acidic, honey, and your lymphatic system's down. But we're all down, believe it or not. Since I was 20 years old, that comes out when I do any physical movement. Okay. So you're doing physical movement, right? What are you doing when you're creating physical movement? You're in a kinetic stance, right? So your cells are in a kinetic activity, right? So everything, including your respirations, increase, right? So the production of cells, if I'm doing this, I'm creating at least lactic acid. Not to mention my respirations, heart rate, everything else, I could be increasing a little bit. So I'm increasing the need for oxygen and the alkaline side, but I'm also producing more on the acidic side. So if I'm producing more on the acidic side, I need to bring more of the alkaline side in. Well, if you're already agglomerated in the lymphatic system, it doesn't matter how much you bring this in, because you've got to break this agglomeration. So what you bring in now has to have power to it. It has to have astringents to it. It has to have the power to hydrate. Well, you only have the power to truly hydrate through fruits, berries, melons, and vegetables. Truly. So that there you have a picture of all that. So when you move, you create more acids, and you're going to hurt. Also, the fluids in the joints, that's lymphatic fluids. You can dry them right up, right? Synovial fluid in your knees, your eye fluid, you can dry them right up. Dry eyes, there's nothing good coming with dry. How long will it take not to have any more cravings for starches? All right, so right there, you need to go on our fungal formula. We have a fungal, this is for fungal, and go on that for a couple months at least. I do that for 2 or 3 months. Yep. And at the same time, get my kidneys to start opening up the doorway, that sort of thing. Watch your food combinations. Separate your fruits from your vegetables. Go as mono as you can. 2 or 3 different, maybe at once. Also above that, she says, I suffer from heavy menstrual pain. Let's just end this right now, because I know you got a pituitary problem. Hell yes. Holy crap. Does she have a pituitary problem or what? This is her right eye. Take a look at that. And Camille, she hasn't mentioned her inability to sleep well. Look all up there. All these radius solaris. Now, honey, this is not good. You see these black lines radiating up into your head area? This can cause brain lesions. And And what else do we see? A ton of nerve rings. Look at these nerve rings. Look at those rings there. You can't have nerve rings. So what do we have? Chronic adrenal glands. If this is the right eye, and if not, it's the left, there's the adrenal gland. Yep. You've got a lot of nerve rings, sweetheart. And what do you guys think? All right, so I want you to look at her eye up here, her right eye. Now, there's a lot of light in it. This is her left eye. And there's a lot of light in it, but see, let me see if do you see any orange maybe in that eye? Could that possibly have any orange? Now, what's the color of her true eye here? What's her true color of her eye? Where am I? Oh, I'm over here. You see these nerve rings? You see that light brown underneath that nerve ring? That's her true color of her eye. All this thick brown on top, that's heavy lymph stagnation, almost to the chronic level. That's why you're feeling your joints and everything else in you. So, excuse me, as a quick look, parathyroid is chronic, pituitary is chronic, pineal gland is chronic. You have a prolapsing of the transverse colon. Yeah, you need to get your connective tissue up and going on this. This is either your right hip or your pancreas. You got a pretty good weakness in that area. I'm going to guess it's more the hip area myself. Gallbladder needs to be cleaned out. You got some bronchial trunk things, but up back here in the right side, probably more mess. Cerebellum probably got a little bit going on there. Real dark on the other side. I can't see it. Now, this looks like the left eye, and the left eye is leg. So I see leg, bone, hips, legs, things like this. So connective tissues for sure. They probably weren't far off with that diagnosis with connective tissue problems. Smart of them in a diagnostic thing, but not smart. I went, how do we fix it? You got genetics, you're done, baby. No. So, and you get back here on the left side, and you're showing weaknesses, almost like the bowels ballooned and affecting your back of your head here. The pituitary is not as bad on the left side, but you got nerve rings all over the place. Here you got mid-back weakness, definitely kidney and adrenals. Your kidneys chronic on the left side, both chronic kidneys. So you got to dig in. I don't know. Is that a light? Or is there a malformation of the iris? I don't know. But that would show more connective tissue problems when you get a little bit of a out of round. So, yeah, I would be going. You're only 32, right? Isn't that what you said? 32. Yeah, you want to make health your journey because you've got your nervous system's down. So you'd be but so many nerve rings, you'd be very sensitive to neurotoxins. That'd be perfumes. There's a lot of neurotoxicity out there. Vaccines, there's all kinds of neurotoxicities to get in trouble with. And you want to be real careful. If anything makes you short of breath, get away from it. But you got to work on your endocrinology for sure. You got to work. I would use a glandular on my parathyroid, and I would use a pituitary formula, or get our endocrine gland formula, double dip it. That way you're going to hit all of them pretty good with that. And then with the parathyroid bump with a glandular, that should help you to start utilizing calcium out of your foods. I would probably do, if I'm you, I'd probably do grapes in the morning or all fruit in the morning. I would probably get into some green drinks, try to get me some alfalfa sprouts. If you want to grow some alfalfa sprouts, grow them till they're really green leaves. They're very astringent when they're dark green like that. But a lot of green drink might, with some chlorophyll, might be a little helpful. You could throw a little kelp or dulse in there just for the fun of it. But a real green drink type of thing for lunch, and then fruit at night again. And just start cleaning your body out. This is hydrating and cleaning. Hydrating and cleaning. Because if you're not hydrated, you get agglomerated. You get stiff, tight, all those things like that. So you've got to hydrate. Again, fruits, berries, melons are your best hydrators. Vegetables are second in line. But you've got some work to do, sweetheart. Got some work to do. Yeah. One more picture of like her right eye. Now I can see her back and everything. Yeah, you got like throat, upper C-spine, moving up into the thyroid, parathyroid weakness, kind of all in that right side right up there. And then maybe some lower back. But I'm looking at, you be careful to have an ovarian cyst too, because you got lymph system backed up in the right ovary and in the pancreas. Looks like a hip problem though on that side. Definitely chronic adrenals, chronic kidney on that side. And a little bit up in the left ear, that whole area up around this area. It's what they call the hepatic flexure. But dig in and go after that. Very, very important. It's almost lunch. So what I'm going to do is I'll read one more and then take a little break and go to lunch, and I'll come back and see if I can't get on down the line. This is a busy week. We got new formulas coming in, more of them. I'm real excited. Although I haven't got the money to get the buckle up yet. That one, I got to try that buckle up. But I got a lot of other ones. In that batch, I've got tissue regenerative formulas and stuff like that. Everything takes money. So this is Charles. He's 80. Charlie boy, you're 80 years young.